I'm Claire Anderson. I'm a professor at the University of Nottingham, but I'm also president of the Royal Pharmaceutical Society, which is based in London, in East London, in Tower Hill. It's the professional leadership body for pharmacists. So we're not a union, we're not a negotiator, but we support pharmacists in their education, their development, and policy, and we talk to policymakers, among other things, represent pharmacy basically. As pharmacists, I think it's really important that I've come along today. Medicines cause 25% of the NHS carbon emissions, and right from when medicines are produced, of the production, the chemicals that are used, right through to the disposal of medicines. Lots of medicines end up in polluting our rivers and streams, and everything in between in the whole medicines use process. There's lots of medicines wastage. About 50% of medicines aren't taken properly or aren't taken at all. So all that wastage, all that lack of recycling of medicines, all the paper that goes into patient information leaflets, so much could be done to change it. We could have digital means for that. We need to look at the foil strip packaging as well. Those sort of things, as well as right back, a lot of the generic medicines are imported from India and China. Is that sustainable? The NHS is paying lower money because they're coming from there, but is that sustainable? So lots and lots of areas, as well of course as an organisation, we've divested entirely from fossil fuels, and we've produced a climate change charter that a lot of our members have signed up to, about how they're going to actually change things in their day-to-day work, how they're going to talk to patients about medicines and reuse of medicines. And also we've signed the Healthy Climate Prescription. And yes, we're encouraging everybody to do more, maybe cycle more, think about their travel, think about their diet. We've asked individuals when they sign up to the charter to think what they can do themselves, and we've given them suggestions, but it's up to them what they actually will do in addition to what we're suggesting. I've already had some interesting conversations with colleagues about what their organisations are doing, and I think it's a really fantastic opportunity to learn from each other, to get to know what each other are doing. And I think maybe we could have a conference later with all of us coming together to speak, because I think that would be really powerful both for our professions and for the public, because we're all doing a lot of things which I didn't realise, so it's been really good already. Thank you. I'm preaching to the converted. But it's really, really important, and I like Martin, I've been on a journey about this, I have to admit, but we've got to do something. So as the Royal Pharmaceutical Society, we've published a series of policies, and we've taken another number of steps to engage the profession, because pharmacists, especially community pharmacists and general practice ones, are really, really close to communities and can make a real difference and talk to people about this, because people are not aware that medicines cause so much harm, I don't think. So we've published a series of policies on improved prescribing and medicines use, tackling medicines waste, and improving infrastructure and ways of working. Sorry, I haven't got much voice. And we've also produced a climate change charter available for pharmacists to sign up to and to commit to a series of actions to make their practice more sustainable, and a lot of pharmacists have signed up to that, and they're able to add to it and personalise it, put things like travel and diet and other things on it. So we've taken a number of steps. In the last year we've divested from fossil fuel and those sort of things. So this is really important to pharmacy, and it's really lovely to be with you all today and meet you all and to have so many interesting conversations, and I hope this is the beginning of something. It's really, really been great. So thank you everybody. One thing we're doing in our conference in November, a quarter of it is dedicated to a sustainability theme. So that's quite a breakthrough, and I hope that will have a lot of interest. I think we've got a very long way to go on this one. Now, I would eventually like to see the BNF highlighting which medicines are more likely to be pollutants, etc. And I'm delighted with my academic hat on. I've just got a grant from the MRC with people from the University of Highlands and Islands up in Scotland, and public health people in Scotland, to begin to look at this issue at sustainable formularies related to water pollution in particular. So there's so many things we can do, and lobbying the APBI is another thing, getting them to start thinking.
So the industry body.
Yes, sorry, the Association of British Pharmaceutical Industry, and about packaging and things like that, and they are beginning to look at that as well, so that's great. And then there's things like most generic medicines are made in India and China. So all major issues around the manufacturing, the transportation, is that sustainable? But would NHS England or the NHS in the other devolved nations pay for medicines that are manufactured closer to home?
Yeah.
At the moment, probably no. So there's loads of issues, and I think we have a powerful voice as the experts on medicines to speak out about this, and it's something you can probably tell I've become quite passionate about just over this last couple of years. So, yeah.
Fantastic. Thank you, Claire.